This is the eHealth Radio Network, your source for health advice on demand. And now your host, Eric Michaels.
This is Eric Michaels, and once again, you have tuned into the eHealth Radio Network and the Dermatology and Skin Care Channels. We're also streaming on demand 24/7 on TuneIn Radio and the TuneIn Radio app for your listening convenience. Today we are speaking with Dr. Catherine Z. Navarro. She is the owner of Navarro Dermatology and Skin Care based in West Palm Beach, Florida. She received her education and training from MIT and Boston University and is board certified in internal medicine. Dr. Navarro, a pleasure to have you with us today here on eHealth Radio.
Thank you. A pleasure to be here.
And the pleasure is certainly ours. So for starters, Dr. Navarro, we're talking about spider veins here today, and I wanted to first ask you to describe exactly what a spider vein is.
Well, a spider vein is a small vessel proliferation that, if left untreated, affects not only your appearance, the quality of life, and can lead to some disabling results such as thrombophlebitis, which is a clot in a vein, ulceration to the skin, which is breakdown of the skin, changes in skin color and texture, which is termed stasis dermatitis, darkening of the skin, which is called hyperpigmentation, and swelling of the legs that doesn't respond to many therapies, which is called refractory edema. And then the worst of it is if you leave spider veins untreated, you can eventually end up with something called lipodermatosclerosis. That's a mouthful, where fat actually infiltrates the skin and the damaged veins, leading to a woody, swollen leg with very little feeling and a lot of scarring.
And thanks for that fine explanation there. Now, in addition to the term spider vein, we also hear a lot about varicose veins. What is the difference between the two?
Well, a varicose vein is a swollen, larger vein. A spider vein is a swollen, smaller vessel vein. You can have varicose veins, you can have spider veins, or you can have a combination of both. People who have either varicose veins or spider veins have a genetic tendency to have very weakly formed elastin and collagen fibers, which allow veins that normally should be nice and firm and not stretchable to stretch out and balloon and actually grow and stimulate themselves to create more of themselves.
Also, Dr. Navarro, what nutritional and lifestyle recommendations do you have for preventing spider veins, and are they even preventable? That would be a curiosity.
Well, they are. There's a lot of things that can be done. There's a lot of myths out there, unfortunately. But both varicose veins and spider veins set off inflammation in the body. We now know that inflammation is the leading cause of disease, and actually is probably the onset of all diseases in the body. So a poor diet, especially high in trans fats, sugar, caffeine, alcohol, and processed foods, contributes to arterial damage, blood pressure problems, and hormonal imbalances. And, of course, it all adds up to that scary weight gain. High sodium diets, with sodium chloride especially, are very dehydrating, and they can contain toxins that actually worsen the veins. So you want to make sure that you have a diet that is obviously the opposite of all that. You want to have foods that are high in nutritional value. They are anti-inflammatory. We know that high-fiber foods, 20 to 40 grams a day, not only prevent constipation and bloating, which puts more pressure on the veins, but they help remove toxins from the body. Chia and flax also contain omega-3 fatty acids, which decrease inflammation and also can be used as part of your fiber program. High antioxidant foods high in flavonoids like berries are wonderful for you. The polyphenols, which you also find in dark-colored berries, have been shown to be beneficial not just for your veins but also your arteries. Vitamin C helps to strengthen the veins, and vitamin E helps prevent blood clots. You have natural diuretics. A lot of doctors erroneously put patients who have varicose veins on chemical diuretics, and they actually cause dehydration and worsening of the problem. But natural diuretics remove fluid but don't cause dehydration. So you can take things like parsley, basil, and cilantro, and you can either eat them on your salad or you can make a nice tea out of them. And then you can eat dandelion greens, cucumber, asparagus, and celery. And these also are natural diuretics that decrease the inflammation in the body and remove the excess fluid in the veins. Magnesium foods that are rich in, obviously, magnesium are great for restless leg syndrome and also cramps that are associated with varicose vein disease. So magnesium-rich foods include leafy greens, avocado, bananas, any of your cruciferous vegetables, your Brussels sprouts, your broccoli, and sweet potato. These are all very magnesium-rich foods. And you also have magnesium-rich nuts, such as the Hawaiian nuts, Brazil nuts. These are all high in magnesium. These are great for people who have varicose veins. Now, if you want to avoid fats, let's say you don't want to deal with avocados and maybe you're diabetic and you can't eat sweet potato, you can buy a product called Natural Calm, which is a magnesium supplement that you make like a tea and will give you a lot of magnesium. And the magnesium not only helps you, but it helps lower your blood pressure and improve your circulation. So again, any of those things help. Now, you also asked me about lifestyle suggestions, okay? Obviously, exercise reduces blood pooling, which makes the veins worse. Exercise balances your hormones, and we know that hormones make your veins grow. That's why pregnant women get horrible varicose veins during their pregnancy. We know that exercise helps to lower your blood pressure, which can contribute to worsening of the varicose veins. So if you can balance your hormones and lower your blood pressure by exercise, you're doing something that really helps your veins and is not a drug. Any kind of exercising, like with bicycle, lunges, calf raises, strengthens and stretches your veins, which is necessary because you want to force blood through these veins, and they get very lazy because they've gotten swollen and blood tends to pool in them. Walking, swimming, and bicycling also helps to alleviate pressure from varicose veins. And it goes without saying that you got to have a healthy weight because this makes all things worse. In terms of other lifestyle suggestions, you can't afford to be toxic and constipated, so you have to have plenty of fiber because any straining on defecation is associated with worsening of the veins. And essential oils are also part of your lifestyle suggestion. Cypress, peppermint, tea tree oil, lavender oil have all been shown to increase circulation and support the circulatory system. So getting in the habit of getting some of these oils, reducing them or mixing them with things like almond oil, and then giving yourself a light massage with legs on the veins in the evening, very, very beneficial. And if you don't want to go that route and can't afford the essential oils because they can be a little pricey, even just boiling lemons to release the lemulene in the peel, and then drinking the cooled water is enough, has enough essential oils in it to help detoxify your circulatory system and improve the circulation.
Certainly helpful information in all regards today. We are visiting with Dr. Catherine Z. Navarro, the owner of Navarro Dermatology and Skin Care, based in West Palm Beach, Florida, here on eHealth Radio's Dermatology and Skin Care Channels, a part of the eHealth Radio Network. Now, continuing on, Dr. Navarro, for those who have spider veins, what are their treatment options?
Well, the treatment options for spider veins, the gold standard has always been sclerotherapy. Sclero means scar, and therapy obviously means treatment. And the basis of sclerotherapy is that we inject you with a solution that irritates your veins enough to scar them down. They will close down and disappear. It's beneficial for two reasons, because it improves the appearance, but more importantly, those spider veins are actually stealing blood from very necessary parts of your legs. And that blood is just pooling there. So it doesn't have oxygen, it doesn't have any nutrition, it's not doing any good. So when you inject your veins and get rid of them by scarring them on the surface, your body slowly but surely dissipates them, breaks it down, and then you're left with a nice-looking skin, no veins, but you're also left with improved circulation because these veins are not hijacking your circulation and putting what you don't need. Okay. The gold standard of sclerotherapy, we usually use two solutions basically. One of them is called hypertonic saline, fancy words to mean that you have a solution of salt that is 290 times as concentrated as the salt in your body. Now, why would you do that? Well, because we know that if you inject that solution into a vein, within an inch of the vein, that solution is now 50%. Within 2 inches of the vein, that solution is now down to 10% diluted. And after 3 or 4 inches, that vein contains no significantly added salt to it. So at the high concentration, it irritates the vein, and slowly but surely, the vein starts to shrink, it actually, the inside of it swells while the outside of the vein gets smaller, and it dissipates. Basically, it starts to form a scar. No new blood with oxygen and nutrients passes through, and that little vein literally gets starved to death and disappears. Okay. You can also use lasers. You can use something like an ND YAG laser on the surface. And lasers work well on spider veins on the face and the hands. I don't find that they work really well on the veins of the leg. You can also use radiofrequency devices like the Van Gogh, the Vein Go, and you can use that on the surface skin of the face and on the arms or hands, and in some rare cases, some of the little tiny spider veins on the thighs. But for the most part, the veins on the legs are not amenable to superficial laser treatment, although they're very amenable if you have large veins and you put a laser inside that big vein. But since we're talking only about spider veins, I will leave that only talking about spider veins. I don't find that spider veins do particularly well with laser on the surface. If you've gotten rid of every vein and now you have very minuscule, tiny, tiny, tiny spider veins, then sometimes it is a good option. And then finally, if you've got some spider veins and they don't go away with injection and they don't go away with laser, you can do something called a microambulatory phlebectomy, where you literally have a little device. It goes underneath the skin. You twist the little vein onto the device, and you pull the vein through the tiny little opening that you've made out, and you literally just kind of hijack that little vein. And, of course, once it's gone, it can never come back.
In conclusion, can you elaborate a bit more about what sclerotherapy treatment involves?
Okay, sclerotherapy has been around for 500 years. It was accidentally discovered when people like Harvey were trying to figure out what was going on with the human body circulation. And what they did is they injected human beings and dogs with all kinds of solutions, trying to figure out if they could get that solution to come out a different part of the body. And what they found out was that for the most part, that vein they injected just closed off and died. And so it's been around for a long time. The way it's done is we take a concentrated solution of salt and water. Like I told you, it's about 290 times as concentrated. We put a little bit of an anesthetic in the form of something like a lidocaine. We spray with a little bit of a surface anesthetic called ethyl chloride. And then with a tiny, tiny little needle, we get underneath the skin right into the vein, and then we put a little bit of that solution. We know we're in the right place when the vein blanches. Okay. Then we pull the little tiny needle out. We put a cotton ball and a tape on it, and we put patients in stockings for 7 hours, for 7 days, while they're standing and ambulated or sitting and ambulating, but not to go to sleep with. And those stockings are 20 to 30 millimeter of mercury stockings. And over the course of the next 7 days, the first day you remove the little cotton balls and tape, and you'll notice some little brown spots and some little black and blues under there. But by day 8 or 9, you should basically not see too much of anything except maybe a residual little ecchymosis, which is a little bruise mark. And in 3 weeks, you should see that the veins look dramatically better, and hopefully most of them are gone. One treatment of sclerotherapy is not going to get rid of any one single vein. So if you have 100 little veins that you treat, about 30 of them will go away with one injection. About 30 of them will need a second injection, and about 30 of them will need a third injection. And that's dependent on where the vein is being fed up from. So if it's being fed from a small feeder vein that you don't see clearly on the surface, you may have to inject that vessel up to 3 times. But usually 3 times is a charm. It's not permanent. I would wish that it were. So when we do get rid of your spider veins, you know, they have a tendency to come back, but not the ones we've treated. And if you do some lifestyle changes, you know, you eat your fruits and your vegetables, you take your bilberry and your berries, you wear your stockings when you're sailing for long periods of time, you do your exercise and your stretching, you should do really well. So we have patients who've had their veins treated with us, and 10 years later they come every year and show me, and I don't really see anything new happening, and maybe on the 10th year they've got some spider veins. Then you have some other patients that make veins much more easily, but most of them are very kind of non-compliant. They don't really watch their weight. They kind of eat what they want. You know, they don't do so much exercising. And they kind of have made a deal with themselves that, yes, they know they're going to have to come more often to get treated, but they don't want to give up all these other wonderful things that they have in their life.
Well, it certainly has been quite informative, and we really do appreciate all the information shared here today, as well as your time. If you would tell our listeners where they can get more information on your practice online, and also how they could be in touch as well.
Okay, perfect. Well, first of all, my website is www.drnwho, as in Nancy, AVARRO.com. So it's www.drnavarro.com, and there's no dot between the DR and the Navarro. Or they can email me at Dr. Navarro, which is DRNAVARRO, at DRNAVARRO.com. Or they can call our offices at 561-333-6366, or the back line is 561-506-6616.
Well, easy enough. Well, Dr. Navarro, again, thanks for your time and for joining us here today on eHealth Radio. Certainly wishing you the best.
Thank you very much, and anyone who wants to reach out to me, we'd be happy to take care of you. Thank you very much. You have a good evening.
And you as well. We've been speaking with Dr. Catherine Z. Navarro, the owner of Navarro Dermatology and Skin Care based in West Palm Beach, Florida. And for more information, simply visit drnavarro.com. And this has been Eric Michaels, and you've been listening to eHealth Radio and the Dermatology and Skin Care Channels, a part of the eHealth Radio Network. And we do thank you for listening. And until next time, enjoy.
Thanks for tuning in to the eHealth Radio Network. For more information or to subscribe to this podcast, visit eHealthRadioNetwork.com.